Today we're going to talk about one of my favorite topics, AMAG, autoimmune metaplastic atrophic gastritis. It's very difficult for me to understand this concept because it combines physiology, histology, anatomy, and why is it important for us to know AMAG? Because one, it increases your risk for neuroendocrine tumors. Two, it increases the risk for gastric cancer. And three, it can cause an anemia due to vitamin B12 deficiency. AMAG that specifically causes vitamin B12 deficiency is called pernicious anemia. And that can ultimately cause death because our nerves and heart need vitamin B12. Okay, so those are the three main reasons why we care about AMAG. What is AMAG? Well, before I talk to you about the pathophysiology, we have to focus on the anatomy. So this is the stomach. Thank you to Oregon State for this diagram. So I want you to focus on antrum versus everything else, like the body, fundus. Why do I want you to focus on that distinction? Because there are certain cells in the antrum that are only in the antrum, and that is the G cells, which secretes gastrin. Now, gastrin has an effect on the parietal cells. Parietal cells exist everywhere except the antrum. And P for parietal, P for pink. They look pink under the microscope. And their job is to secrete acid to acidify the stomach. And a signal that tells them to secrete more acid is gastrin. In addition to parietal cells, there are neuroendocrine-like cells called, or neuroendocrine cells that are called ECL-like cells, enterochromathic-like cells. And these exist where the parietal cells exist, everywhere except the antrum. Now we have that solidified. The pathophysiology of AMAG is the patient develops autoantibodies against parietal cells, okay? Your parietal cells then die off. Your body has an immune reaction and kills off your parietal cells. Your parietal cells are responsible in producing acid. So there's no acid. Your G cells in the antrum says, hey, what's up? We need to produce more acid. So they produce more gastrin. Now, gastrin's effect, in addition to parietal cells, will be to tell the ECL cell-like cells to divide, and they undergo hyperplasia. And over time, that increases your risk for DNA replication errors. And so the ECL-like cells, if left unchecked, has a high risk of developing into neuroendocrine tumors of the stomach. Okay. Now, I didn't cover another function of the parietal cells, which is to secrete intrinsic factor, which is used to help with vitamin B12 to help absorb vitamin B12. Now, what happens if you don't have parietal cells? You don't have intrinsic factor. You can't absorb vitamin B12, hence pernicious anemia. We cover the two risks of developing neuroendocrine tumors and vitamin B12. How about gastric cancer? Well, remember, your stomach is inflamed because it's your lymphocytes attacking your parietal cells. And that's going to cause chronic damage. Your body tries to adapt to that damage by undergoing something called intestinal metaplasia. So it becomes like cells of the colon, of the intestines, and it has prominent goblet cells. Over time, though, if left unchecked, that metaplasia will become precancerous or dysplastic and has a risk of transforming into adenocarcinoma. And that's due to just the chronic damage, the chronic division, the increased risk of DNA replication errors, okay? All right, so the main etiology for AMAG, autoantibodies to parietal cells. So this is a histology of parietal cells. Remember, P for pink. So these cells are parietal cells. Okay. Now, let me show you what, this is another view of parietal cells. Thank you to Path Outlines for this section. Now, do you see any of the pink cells that we saw previously? No. So this is normal antrum. This is what antrum looks like. Remember, no parietal cells in the antrum. There are G cells, kind of hard to appreciate on regular H&E stain, but you can do stains to confirm that they're G cells. Okay, so I guess let's go back. Now, what if all the parietal cells are destroyed because of your autoantibodies? Then what will it look like? It'll look like antrum, right? Antrum just doesn't have the pink parietal cells. So just letting you know, your the endoscopist can biopsy a section of the stomach and say it's body that they sampled, but it looks like antrum. If that's the case, then you want to suspect AMAG, especially if there's intestinal metaplasia as well. Now, a clinical sign of AMAG is diffuse loss of rugal folds of the stomach, as you can see here. Thank you to Path Outlines for all these images. Now, this is intestinal metaplasia here. This looks like colonic epithelium with the goblet cells. So if you see this, you want to think in the back of your head, AMAG. Now, this looks like antrum, right? There's no pink cells, but if this patient has AMAG, I honestly don't know if this is actually from the body or everywhere else or versus the antrum. Now, this stain is chromogranin stain, and this chromogranin, you shouldn't have ECL-like cells that are like more than 5 touching each other. Here, you see more than 5 cells in a group, right? So this is ECL-like hyperplasia, and why is that? It's because the gastrin, the overproduction of gastrin stimulates the ECL cells to undergo hyperplasia. And so this is not the antrum, this is the body most likely, because you have these ECL-like cells. And so if this goes unchecked, remember the risk factor is neuroendocrine tumor. See another area of intestinal metaplasia, and we see the destruction of the parietal cells in action with all these lymphocytes. So this one, this is a gastrin stain, and gastrin stains only G cells. So because these G cells are staining, we know that this is antrum, in fact. And here's a case of a gastrin stain where the G cells aren't staining. So we know for a fact that this is anywhere but antrum. So you can survey these patients, and you just want to make sure that that the intestinal metaplasia doesn't become dysplastic and ultimately lead to cancer. You also want to make sure that there are no neuroendocrine tumors, and you also want to make sure clinically that they're doing okay, that they're getting vitamin B12 supplements. So I hope that this was a useful overview of AMAG, and I will see you next time. Bye.